Hello and welcome to GAF University. My name is Rodolfo Sierra and today we'll be talking about Medicare savings programs. What is a Medicare savings program? Well, that is a state program that, depending on the level, may help pay for Medicare Part A, which is hospital insurance, and Medicare Part B, which is medical insurance, which covers deductibles, co-insurance, co-payments, and only if you meet certain conditions. You can see on the bottom of the slide here, you can see kind of what the cards look like when you qualify for Medicare savings, or HELP, or Medicaid. If you want more information, you can find it on page 99 of Medicare and You 2021 Handbook. There are four kinds of Medicare savings programs: Qualified Medicare Beneficiary Programs, also known as QMB, a Specified Low-Income Medicare Beneficiary Program called SLMB, Qualifying Individual Program, also called QI, or Qualified Disabled and Working Individual Program, QDWI. So if you qualify for a QMB, SLMB, or QI program, you will automatically qualify to get extra help to pay for Medicare prescription drug coverage. In the next couple of slides, we'll be going over each of these programs and how they help. So to begin with the Qualified Medicare Beneficiary, or QMB, if you qualify for this program, it will help pay for your Part A premiums, your Part B premiums, and any deductibles, co-insurance, and co-payments. After we go through all these programs, we'll go into the details of what qualifies for these types of programs. And there's different levels based on income and resources. Here's an example of what a letter looks like whenever you receive QMB status. Now, for the purpose of privacy, we deleted all the pertinent information here, but you can see the letter will show up on the bottom here. You'll see a QMB status on the bottom, and you'll see the date when they qualified and how long they qualify for. As long as you keep meeting the income and resource requirements, you'll continue to qualify for this level of support and extra help. The next program is Specified Low-Income Medicare Beneficiary, SLMB. This program will only pay for your Part B premiums. All right, you can see that your Part B is your medical. Here's another example of what a sample award letter looks like. You'll see again your name or your client's name, depending who's watching this video, and you'll see the SLMB on the bottom here, and then when they qualified and for how long they're qualified. Again, typically it's going to be ongoing as long as you continue to qualify from an income and resource perspective. The next program is called the Qualifying Individual Program, the QI. Now, QI applications are granted on a first-come, first-served basis, with priority given to people who already gotten or received the QI benefits the previous year. This program also helps pay for all Part B premiums. Again, that is the medical portion of Medicare. Here's a sample letter of what that looks like. Again, you'll see your client's name here and the benefit QI1 program and when they qualified for. Again, this is a first come, first served basis. It's qualified on an annual basis. So remember to continue to apply if you've received this benefit. The final program is the Qualified Disabled and Working Individuals Program, QDWI. This program helps pay for your Part A premium. You may qualify if any of the following apply to you. 1, if you are a disabled working person under 65, if you lost your premium-free Part A when you went back to work, you aren't getting medical assistance from your state, and you meet the income and resource limits required by your state. Remember, this program only pays for your Part A premium, which is the hospital portion of Medicare, not medical. Here we go into more details as to what qualifies an individual or a couple for a Medicare savings program. On the top, We have it broken down by individuals on the left side and couples on the right side. So for example, in order to qualify for the QMB status that helps pay your Part A deductible, Part B premium, deductibles, and coinsurance, income needs to be less than $1,094 on a monthly basis, and resources need to be $7,970 total. From a couple perspective, income needs to be at $1,472 combined on a monthly basis, and resources no more than $11,960. For an SLMB program qualification that helps pay for your Part B premium and assist with some other services if needed, the income tends to be a little bit higher from an individual perspective at $1,308 a month. But the resources remain the same at $7,970. From a couple perspective, income needs to be less than $1,762. Resources $11,960 combined, same as the QMB. Now from a QI1 status that helps pay for either Part B or assist with some provider services, income is a little bit higher than the SLMB and QMB from an individual perspective at $1,469, but resources remain the same. From a couple perspective, income at $1,980 a month, and resources again remain the same. The last program is the QDWI program. This, remember, only pays for the Part A premium. This income tends to be higher because there is a working individual versus somebody who is potentially not working or receiving assistance. So you can see the income is a little bit higher at $4,379, but they drop the resource qualification. Same from a couple perspective, income is at $5,892 and resources no more than $6,000. And then the last program, which we didn't discuss but we'll talk about here right now, is called the LIS. This is the Low Income Subsidy. This is the program that helps pay for or helps lower prescription drug costs. So as we mentioned earlier in the presentation, you'll see that if you qualify for a QMB, SLMB, or QI status, you automatically qualify for the low income subsidy for prescription drug costs, and that's because the monthly income requirement of $1,610 falls within the QI, SLMB, and QMB status. Also from a resource perspective, the $14,790 for individual, it encompasses any of these other statuses, and also from a couple perspective, at $2,177 and resources of $29,520 encompasses the QI, SLMB, and QMB status. So these are all the Medicare savings programs. And as a reminder, depending on the qualification that your client gets, your Part A deductible is at $1,484. That Part B premium is $148.50 a month or more, depending on income. Part B deductible of $203 annually, and any of the Part B coinsurance is 20%. So you can see, qualifying for a QMB status helps cover a lot of the costs of original Medicare, and also with an SLMB perspective, it also covers some of those costs. So typically when we see people that qualify for these types of savings programs are seniors that are on a Social Security check only. If that's you or if that's one of your clients, really explore into looking at some of these Medicare savings programs. It can save a lot of money when it comes to the healthcare costs. Now, I bet you're asking yourself, what is resources? What does that mean when they say $7,970 of resources or $11,960? Well, the next slide kind of goes into what exactly that means. So there are resources that count towards that money and some that don't. Countable resources include money in either a checking or savings account, any stocks or bonds. That's it. That's what counts as resources. What doesn't count as resources is your home, one car, burial plot, up to $1,500 for burial expenses if you have put that money aside, furniture, or any other household and personal items. So when you go and apply for Medicare savings, you have to take this into consideration as you're applying, because if you exceed the limits, you'll automatically be disqualified. Now, if you're just above it, there is a sliding scale. You may be able to qualify for some help, just not all of it. So if you're within the range, definitely apply, because you never know what the state will provide. In order to do that, there's a couple ways. First and foremost, you can go in person at the Health and Human Services offices. Now, given the day and age that we live in, that may be hard to do and the lines might be very long. So it's an option, but not the best option, in my opinion. Another option is to complete the paperwork, like print it out and actually complete it by hand and send it in via fax. And the fax number is here on the screen for the state of Texas is 1-877-447-2839. That typically is a good way. You will get a response in a couple weeks in order for them to process the paperwork. Could take longer depending on the backlog. So again, good way, but not the best way. The best and preferred way is to go online. Go to www.yourtexasbenefits.com and apply online. That is the easiest, fastest, correct way. You will minimize or pretty much eliminate all of your mistakes because you can't submit an application if information is not entered. And you'll be able to get a response hopefully within days or potentially a week or two versus a couple weeks on a paper application. All right. So this is the best way to go and apply if you feel like you qualify or if your client qualifies for this type of benefit. Well, that completes our video for today. Thank you for watching. Please check us other videos out at our Global America Financial University YouTube page. My name is Rodolfo Sierra. Have a fantastic day.